My name is Itta Aswad, and I'm the HIV Services Manager at the Alameda County Medical Center. Here we are focusing on implementing panel management interventions within the HIV world and setting. So the purpose of panel management is to be able to take some things out of the clinician visit, allow for other members of the team, such as the MAs and the nurses, to remind the patient and really bring them into their care and empower the team as well as the patients to make sure it's really a patient-centered medical home model.
I'm paying attention. I want to be more involved and try to encourage the patient to kind of be involved as well, like kind of be a team, and for them to kind of self-manage some of these things and the reason why they're having the test. I get the opportunity to explain to them certain tests and why they're having them, opposed to here's a lab sheet, go and have these labs and we'll check back in with you.
Some of the tools that we are using to do this are registry reports, which show you all of the health and maintenance activities, visits, viral load needs of the patients at one time. So you're managing the entire panel, not just one patient, as well as the decision support tool, which is a flag or system for the MAs and the clinician to say these are the interventions that we need to take right now so they do not fall through the cracks. The pilot program here at ACMC, we are currently using one clinician and one panel of patients, but plan in the future to roll this out to the entire clinic.
See, I love the panel management, but of course there are challenges. The biggest one is when you predict, which is time. I need time to meet with Monica, to go over the registry and to go over our summary reports. And that is not always obvious in the day where to do that. Second thing is that she's helping me bring in people who've been lost and who are sick. They're people who've been lost to care. I find that my days are longer and sadder because I'm spending time with people around what's hard for them. But then the third challenge is that there's all this exciting stuff that I get to do for people that's really about wellness. Not about the sickness of HIV, but about what they need to do to stay well. And just kind of marrying those two pieces together is the excitement I get about talking to people about how to prevent them from getting pneumonia and exercise and going to the dentist and all that. Marrying that together with the thing I always used to talk to them about and still need to about their HIV. Well, for the time thing, the solution is either to book an appointment to do that, so to not see a patient in one session, or to find time in a no-show slot or find time at the end of clinic. Those are the only solutions we come up with. For the sicker patients, it's really about teamwork and bringing in our psychologist, bringing in our social worker, because those folks that we're bringing back into care, they have big social problems in addition to their medical problems. So I need to rely on my team, on my colleagues, to help me with that. And then in terms of the marrying of prevention and the HIV disease care, it is a challenge, but it doesn't need a solution. It's a happy thing going forward, and it's really me just thinking about it differently, about how to talk to my patients and how to work on those two things simultaneously.
Some of the solutions I feel that panel management could offer is, first of all, working together as a team with the patient. And I feel like once the patient feels like they have this great team and this support, they want to be more involved. They know why they're having certain tests. They know why they're taking certain medications now. They know why it's important for them to do these things.
So the exciting thing about scaling up from pilot project to everybody doing it, to me, is the sustainability piece. Then I think our quality numbers are going to go through the roof. Patients are going to get used to it, and I think they're really going to like it. And we're going to then be able to make it something that is normal life in our clinic.